So let's talk through a differential diagnosis of a woman presenting for pregnancy care who's not actually pregnant. The first item on the differential might be pseudocyesis. Pseudocyesis is a condition described since the time of Hippocrates and is currently included in the DSM-5 as an other specified somatic symptom disorder. Defined as a false belief of being pregnant that is associated with objective signs and reported symptoms of pregnancy. In pseudocyesis, a patient's conviction may or may not be swayed by lab testing, ultrasonographic evidence, or physical examination. Classically, the patient has no other signs or symptoms of a psychiatric disorder, and frequent antecedents are pregnancy loss, infertility, isolation, naivete, and a belief that childbearing is a woman's crucial role. Pseudocyesis is a rare disorder with decreasing incidence. Some hypothesize that the development of readily available objective methods of confirming or ruling out pregnancy in the earliest weeks of pregnancy, such as the home pregnancy test, explains the decrease in prevalence. It should be noted that while data on the prevalence of pseudocyesis is lacking, it is hypothesized that pseudocyesis is relatively more common in developing countries, which place a high cultural value on childbearing. A simulated pregnancy is a presentation of malingering where the patient knows consciously that she is not pregnant but presents as pregnant for secondary gain, such as employment reprieve. A historical example is Marie Gouze, a 16th century French activist and writer who famously and unsuccessfully feigned pregnancy to escape the guillotine. Couvade syndrome also warrants a brief mention in this differential. The name Couvade syndrome has its origins in the French word couver, meaning to hatch, and is also known as a sympathetic pregnancy. In this syndrome, the expectant father experiences somatic symptoms of pregnancy. Relative to pseudocyesis, scientific literature on Couvade syndrome is scarce and limited to case reports, and there is no mention of Couvade in the DSM-5. In the literature that does exist, Couvade syndrome is hypothesized to represent a somatic expression of anxiety, identification with the fetus, ambivalence about fatherhood, or parturition envy. And finally, we come to delusions of pregnancy. These are fixed, false beliefs of pregnancy that occur usually in the setting of a chronic mental health condition. In contrast to pseudocyesis, delusions of pregnancy occur in the absence of unexplained objective signs and symptoms of pregnancy. The majority, but not all, of patients with delusions of pregnancy are female, and notably, about 1/4 of patients with this presentation are over the age of 50. The most common underlying diagnosis is schizophrenia, accounting for more than 1/3 of patients in one study. Other associated diagnoses include other psychotic disorders, mood disorders, or dementia. Interestingly, about 20% of patients with delusions of pregnancy are found to have hyperprolactinemia. And it's possible that misattribution of the physical symptoms of this medication's side effect with signs of pregnancy has played some part in the development of these delusions. Delusions of pregnancy can be associated with perception of fetal movements or with related delusions such as erotomania. It is important to remember when examining any woman presenting with a false belief that she is pregnant that organic causes and contributors must be included in the differential diagnoses. Secondary amenorrhea can result from dysfunction of the hypothalamus, pituitary, or ovaries. Hyperprolactinemia from endocrine abnormalities or antipsychotic medications can clinically present as galactorrhea. Abdominal distension may result from constipation, metabolic or endocrine disorders, or liver disease. Gestational trophoblastic disease may result in multiple symptoms which mimic pregnancy. An astute clinician will include a thorough history and review of systems in the examination of these beliefs, followed by appropriate physical exam, laboratory testing, and/or referral to other physicians when indicated.